About 9 months ago, I started getting earaches, particularly in my left ear. And my jaws were getting tired if I ate difficult food to chew, like steak or something like that. And I was getting clicking in my jaws. The earaches were particularly troublesome because they were quite painful. So I made a round of doctors, MDs, asking for penicillin or some other kind of antibiotic. And they all looked at my ears and indicated there was no infection, so they weren't going to prescribe medication. I finally went to a different, after a variety of physicians, I finally found one that said I probably had TMJ. And he was very sorry to diagnose that because there was nothing that could be done. I then went to a couple of different dentists, and they indicated that there were some very expensive procedures, including surgery, but that the outcome was problematic at best, and there may be no relief. At about the same time, I took a one-week vacation in Palm Springs, and I was flipping channels, and I happened to come across a commercial by Dr. FELD. And since I had recently been diagnosed with TMJ and he was talking about TMJ, I listened to it with great attention, took down a phone number and gave him a call. I was able to meet with him in Palm Springs, and he said yes, the diagnosis of TMJ was in fact correct, and he referred me to his Maywood practice in Los Angeles, because that's the general area where I live. So I went to visit him in the LA area, and he indicated that his preference was to use minimally invasive procedures, specifically appliances, like a retainer as an example. So I was given a retainer for the bottom that I wear during the day, and a retainer for the upper teeth that I wear at night. It took about 30 days before I noticed that the earaches had greatly subsided, and by the end of about 45 to 60 days they were completely gone. I was able to eat more substantive food, and the clicking of the jaws had gone away. I was dumbfounded, but extremely pleased. The appliance is extremely easy to put in. I clean it once a day for about 5 to 10 minutes in a little Efferdent, the same kind of solution you use for dentures, but it's not a denture, of course, it's a retainer. There is no discomfort whatsoever, none. The only thing I notice is that it interferes a little bit with my tongue, so that occasionally some of the words that I say sound a little bit different than they used to sound when I wasn't wearing the appliance. I was amazed at the thoroughness between the x-rays, and they had various other tests that they performed, including photographs and so on. I'd had the experience a couple of times, several times, where I'd forgotten to put the appliance in the morning, and then I left the house and I didn't have the appliance in. Well, by the end of the day I had my normal earache, and my jaws were tired from eating even, in one case, 6 strawberries. I am very convinced that it's in my best interest to continue with the appliance. So I informed him that I had every expectation to die with the appliance in my mouth, so that he would be able to tell if I died in the morning or in the evening. Just, you know, the coroner can inform him which appliance I had in, and then that would give the time of death. The explanations are very thorough. I am flabbergasted at the amount of knowledge he has and the number of sheepskins diplomas that he has. I have a fair number myself, and they don't compare with his warehouse of, of diplomas. It's really astounding. And the individuals that actually treat TMJ are very, very small in number, pursuant to my research anyway. And that's one of the primary focuses of his practice is TMJ. and it's a very problematic difficulty, but I am just extremely pleased at the results, and couldn't speak highly enough of the attention that I've received here. The way Dr. Feld explained it is that joints have cartilage in between them as a shock absorber. As an example, our knees, most people are aware of that, right, for skiing and so on. And then elbows also have cartilage. Tennis elbow is another example. And then rotator cuff in our shoulders and so on. And in our backs have a lot of cartilage to cushion between the bones. Well, the jaw connects to the skull, and there is small bits of cartilage that fit between the jaw and the skull. And those cartilages can get either broken down or they can get shifted. And if they're shifted, then the bone rubs against bone and it irritates. And that's why I was getting earaches, was because that little piece of cartilage had shifted to the wrong place and it wasn't cushioning where it was supposed to cushion. So the way Dr. Feld explained it to me was the appliance realigns my jaw to allow that cushion, that cartilage, to get back in the proper place where it's now cushioning as it should. Another classic symptom of TMJ is that you have lots of dental work in the back of the mouth, but none in the front. I have interviewed some other people who have gone through extensive procedures, including redoing all of their teeth, grinding them down and making artificial type teeth, surgery in the jaws and so on. It can be wildly expensive. The ones that I interviewed really didn't work, and they paid huge amounts of money. These appliances are not cheap, and they aren't free, but they're much cheaper than the alternatives, and it seems to me wise to investigate the least expensive procedure first. No surgery and no medication. There's no downside to it.